Do you or someone you know have ADD, ADHD, autism spectrum, or a sensory processing disorder?
Well, today we're here to talk about it in a whole different way. And I guarantee today you're going to hear about these diagnoses and symptoms in a way you have never heard before. So I'm totally excited. Here we go.
Hey everyone, thanks so much for joining us on Transform Table Talk Live. I'm Anna Manuel alongside Dr. Maggie Yu. And Dr. Maggie, I want to get right to it. What is behind some of these symptoms associated with ADD, ADHD, autism spectrum, and sensory processing disorders?
There's a lot of people like kids and adults that are being diagnosed with these diagnoses. And that's the people that have these diagnoses. When you're looking at ADD, ADHD, autism spectrum, and sensory processing, a lot of people don't realize that there are a lot of people with dual diagnoses, triple diagnoses. And currently, when you look at the DSM, there's no way to actually put it into like a dual you're either this lane, or this lane. When the reality of the matter is many people have multiple of those issues combined. And we see that all the time. And so today I'm actually really excited to talk about whether you have the diagnoses or you don't have the diagnoses. You're not going to want to miss it today. And I'm going to tell you the number one thing, just right off the bat, that I think is the holy grail in decreasing or ending these symptoms. And I'm going to already tell you it's going to be blood sugar.
Okay, wait a minute. That's sending off like a lot of mind blowing at the moment, because blood sugar is what's behind all of these symptoms.
Yeah. And I'm just going to say that, put that out there right now. And I want everybody who's watching right now, if you're an alumni, somebody in our current program, and I would love for you to tell us, that in the comment section, what your chronic issues you've been struggling with, what are some of the biggest ahas you've been learning in the program. If you could just put that in the chat, that would be great. For the rest of you, I would love for you right now, if there's somebody whether it's in your family, someone that's struggling with any of this, put their name right now in the comment section, so that raising awareness, I think, is really important, so that they get to hear what you're going to hear today right now. Mm-hmm. And then, so yes, blood sugar.
Yeah, this is a really big topic, because I know recently in the Transform Facebook group, you asked, okay, what's keeping you up at night? What's some of your biggest issues? And a lot of people said things related to the topics that we're talking about tonight. It was poor attention span, trouble with focus, concentration, feeling brain fog, kind of just feeling like they were losing their mind in some cases. And so we really wanted to spend some time on this.
Well, and then when you're looking at also, it's the inability to focus, or hyper focusing so much that you can't really focus sometimes on things that you need to for daily function. And then you're looking at also things like, when you're looking at autism spectrum, when you're looking at sensory processing, there's definitely a different way of that sometimes you feel disconnected, or the connections that other people might be making, you're making it differently. I love to say that when you're looking at ADD, we call it attention deficit disorder. It is not an attention deficit. I have heard this said before, and I love whoever coined this. It's an attention differently disorder.
Mm-hmm. And I feel not a deficit, but different.
Absolutely. And so
expand upon that. How is it different?
I think it's different because I think we, and I'm going to just say that because I myself have been diagnosed with ADD, ADHD. And this goes to also, regardless of whether even if you don't have the diagnoses, how many of you right now have symptoms that we just talked about? Type it into chat right now. Mm-hmm. And so I myself was diagnosed with ADD, actually ADHD, hyper-focused ADD, and had been on medication for, I think, 5 or 6 years. And I have a son who was diagnosed with autism spectrum when he was a very young age. So this is a topic that's near and dear to my heart. And regardless of whether you or someone have that diagnosis, I can tell you right now, many people that we deal with have those symptoms. And I love the fact that in our program, this is something that we can really, actually, in a lot of ways, easily address, but completely out of the box.
Yeah. And so many people, you see them turn around their own symptoms very quickly once they focus on proper blood sugar mastery. And so, this isn't to try to say that some of these bigger issues, maybe when you're getting spectrum diagnoses, ADD, ADHD diagnoses, or sensory processing disorder diagnoses, these are real diagnoses, right? This is not something that, we're trying to say is made up by any means, but this is something that can be addressed. The symptoms can be addressed.
Well, but here's the thing is, and I'm going to address this because traditionally we've been diagnosing kids with this, but more and more there's also an epidemic of adults now being diagnosed with this. And somebody can say, oh, are we just raising the level of awareness? Is our diagnostic criteria better? Or, and I'm going to put this out there, is I also think that many people are erroneously, as adults, diagnosed with this. And I'm going to use myself as an example. Because if you have ADD, ADHD as a diagnosis, traditionally, most of the time it starts as a child, but yet we're diagnosing a lot of adults who didn't have symptoms with it previously, and now we have it. And I'm going to tell you that I can't wait to discuss the fact is there's a lot of underlying root causes of things that are happening to us medically that makes us look like we have these diagnoses. Because do I look like I have ADD? Do I look like I have ADHD? Do I look like any medication for it? I haven't been on any medication for it for over 10 years. And I have better focus every single year of my life than I did the previous year. So was the diagnosis actually correct? And do I even care that whether I was diagnosed with it or not? I really don't. And what I find in the program is if you have symptoms of that, let's end it. Let's deal with it, whether you're a child, a parent of a child, or you yourself have those symptoms.
It's like Elaine says, she said, I'm in the program now, and it definitely has helped me with focus. So you do see that time and time again. As I went through the program, I saw people, from the start to the finish, you kind of see that brain fog start to lift. The focus really becomes clear and there for them.
100%. And this applies to the brain fog population, because for me, my actual biggest symptom was brain fog. And that's when I was diagnosed with ADD. And I don't have ADD, but the main symptom is brain fog. How many of you out there in the audience watching right now have brain fog that you didn't used to have before? And what we're finding is a lot of adult men and women are coming down with the symptom of brain fog, and then they're getting these diagnoses and labels. Well, did you have it your whole life and suddenly now it's getting diagnosed? Or is this really something new and there's a new cause that you have to be aware of?
Very interesting. And it's nice to be able to hear that there's something that can be done about these symptoms because, and maybe we'll talk more about this, in the conventional world, what are the treatments? What can be done for this? And in many cases, it's severely lacking, and that can leave people with a lot of frustration. So I can't wait to hear more about the solutions that you have. Number one, of course, being, as you mentioned, balancing blood sugar. And
we're going to have some special guests, and I don't want to just say blood sugar and leave you hanging, because we're going to go deep dive into this.
Yeah, the special guests tonight, I think you're going to really be excited to get to hear some insightful information from our two guests. I'm going to go ahead and bring them both in right now. We have Ms. Jody and Ms. Bex. Thank you both so much for being with us. Jody, could you just go ahead and introduce yourselves to our audience?
Sure. Thank you for having me. My name is Jody Howe, and I am a retired elementary school principal. It was a public school of 500 students, and of those 500 students, 100 plus were preschool autism children. And I was in education for 26 years. I am currently in the Transform University program. I'm in week 9, and I decided to join the program because after many, many, many months of feeling unwell and having symptoms and more symptoms and just losing quality of life and really being annoyed with the doctor merry-go-round, I decided to join the program to get to the root cause. And I have to tell you that I am a heck of a lot better than what I was 9 weeks ago.
And you're going to have a really interesting perspective too, because I know you have worked with so many children who have some of these issues that we've been talking about. Maybe they're on the spectrum, maybe they're dealing with ADD, ADHD, or sensory issues. And you have a large number of them in the schools that you worked in. And you have some interesting takes on what was being done in school versus what you saw in the Transform program, and how maybe some of the principles in the Transform program could have been extremely beneficial for these children.
Absolutely.
I cannot wait to hear more about that in a moment. First, let's say hello to Bex. And I just want to say Bex is somebody near and dear to my heart because she and I went through the Transform program together. We were actually in the same pod. So I've known Bex for several months now, and we've gotten obviously very close, had a lot of intimate conversations throughout the process. Bex, thanks for being here.
Thank you so much, Anne. It's a pleasure to be here. Thank you. My name is Bex Boyer-Taylor, and I am a mother of 2 autistic children, and I myself have autism, ADHD, and sensory processing disorders diagnosed.
All 3.
All 3. All 3.
And Bex, now, I have to say, I saw a big change in you as we went through the program. Just touch on that a little bit.
I can hardly see the person that I came into this program as the woman I see in the mirror today. When I came into this program for fibromyalgia, long COVID, and mast cell activation disorder, I had no clue that it was going to also give me my life back, make my brain function again, allow me to do things, dream. It's been amazing. I think the first time I ever talked to Anne, I was just anxious and nervous and scared in our pod group, and never thought that I would be able to make friends with those women and have deep and lasting relationships, and I do.
Boy, have things changed. I will say Bex is one of the leaders truly in our pod, actually. She is somewhat of the glue that holds us together sometimes and really provides some profound insight in our discussions and helps propel us along a very positive path, Bex. That's truly how I feel.
Well, I think this really highlights a couple things. I think, whether you're an adult or a parent or yourself having those symptoms, this is a very lonely journey for most people. And even Jody, I mean, you've seen people, families, your school was like one of the magnet schools pulling in a huge special needs population. But these parents are really struggling a very lonely journey with this. Mm-hmm. There's not a lot. I feel like, traditionally, conventional medicine really doesn't have very good answers besides in ADD, ADHD medication. In autism spectrum, I mean, really, I'm going to ask both of your experiences, what is that conventional approach like in the schools and medically for you guys?
Well, in the schools, you're limited to what you can do. I mean, the children get a diagnosis coming in, they're provided an individualized education plan, and the teacher needs to, follow what's in the plan to help the child reach his or her goals, specifically, what social, emotional, so on and so forth. So, and then they do parent meetings. But it's very general. They'll bring in speakers, but I think that it's very black and white per se. Yeah. I think, and they're not looking at, in my opinion, not looking at the root causes and the whole picture.
Well, I mean, and Bex, for you experienced it as what three diagnoses. So can you share your experiences on both sides of that, being the parent and being the person with those diagnoses?
Well, I'm 56, so there was nothing in school for me. I mean, I've suffered from, so many, I was so different. I didn't fit. No matter how hard I tried, I didn't fit. I had very few friends going up through school. I had a lot of problems in the education system because I was identified very early as having a very high IQ, and I read at age 3, and wow. Concepts came very quickly to me, but I had problems with dyscalculia and dyslexia that were not diagnosed until much later on because my intellect allowed me to bridge across those. But I didn't have very good self-care. I would deep dive into things, like I would, get so focused on things that, I'll just be honest, that I would forget to go to the bathroom, because I was just so focused on things, because I was just really interested. And, there was very little help for me. I think the one thing that kept me going was that I had a very high intellect. And so I was able to survive and just kind of, learn how to mask and learn what to do and what wasn't okay, and usually though it was very brutal. if I messed up and I didn't do, the socially appropriate thing, there were quite often physical punishments.
Yeah.
For interrupting, the male teacher. How dare I interrupt him and correct him? I would get, I've been spanked for things like that.
Yeah.
And,
and I myself, I mean, Bex, I was the class clown.
mm-hmm.
So I was the one literally with the dunce cap in the corner of the room.
Yeah.
I can see you being the jokester, Dr. Maggie. I can see it.
I was told actually in school that I would never amount to anything.
Me too.
I would never amount to anything. But that wasn't because necessarily of ADD type things. I just think it was, I just always thought differently. I think, and I was raised in Hong Kong until I was, I think, fourth grade, fifth grade. Then I was in the U.S. And interestingly, as soon as I came into the U.S., where I wasn't in a system where conformity was the rule, I started to excel in school as soon as I hit fourth and fifth grade. So I always think about the cultural context sometimes of what the expectations of children are also will sometimes cause kids to be diagnosed with certain things. Right. Mm-hmm. And then my own son, he was in special education from first grade to fifth grade. And when you think about it, it was the teachers that was pushing for a diagnosis because they wanted this child out of the room, or they wanted my child to receive special services. We had to fight our way to get our child out of special ed in fifth grade. Mm-hmm. And once we got him out, he was because he was doing so much better. He was actually, he has done wonderfully in school since then. He's currently getting a master's degree in accounting at USC. So, just saying is that, I think the cultural context matters. Also, I think the way the system is working, I think also traps a lot of parents and kids into certain routes that sometimes they may or may not belong in. And so let's go back to blood sugar, mm-hmm. because Jody, you and I had a conversation about this. In our program, I mean, I'm like this is the thing that I think is really key is people don't realize that these blood sugar swings is a big, big issue. And many people watching right now be like, I got my blood sugar licked, and we have hundreds of resources around why blood sugar is so critical in a symptom like brain fog, in sensory processing. And my question for you is, in your experience, Jody, I'm going to ask you, what did you experience with your own blood sugar ahas? How do you think, that's first, let's ask that first question.
Personally, so I was not aware that I was having fluctuations in blood sugar, and until I, learned it through your program, and what a difference that affects, that's an umbrella that affects everything. And so once you can have solid understanding here, it's connecting the art and science of managing, blood sugar. And it's amazing, even just a little tweak.
Well, and I think about Bex, we saw immediate symptom relief and changes in you. What was your experience with that?
Immediate. It was literally within the first week when I was really following along with, eating regularly. My brain fog almost went away within the first week. And we're talking years long brain fog. The inability to remember my own name sometimes. And I'm not over exaggerating. Really just acute problems with that, not really understanding how things were, just really suffering. And within that first week, just making sure that I had those regular meals, making sure that I had my fat and fiber and all the things that I needed to have.
Balancing the macronutrients.
Oh yeah, the macronutrients. Right. And it just, oh, wow. It was like a light switch turned on.
It is. Well, and here's the thing is that people don't realize our society is focused on high blood sugar. I'm not a diabetic and I'm fine. And the problem is people don't realize is that the problem here is that the blood sugar is swinging up and down. And the big change between high to low blood sugar, which is the area of change, I call it the delta, is really big. And that delta swing from high to low and low to high triggers the worsening of these symptoms as you go throughout the day. Okay. And we're looking at a very sugar vulnerable population. Think about yourselves and think about all the children that you guys see. Imagine if you have ADD, autism spectrum, or sensory processing, or a combination of those, what are you going to eat most, Billy, of?
Carbs.
Carbs.
Yeah.
Carbs,
Refined carbs.
really refined carbs. I mean, go ahead, Jody.
So you take that, and as I'm processing this all, and I'm thinking back to the school, it's just amazing how if we've just, children with autism have obviously sensory issues and food, and so they have a higher issues with food intolerances, and then they only want to eat certain textures of food. So then you have nutritional issues, and so it's like this big spiral. But now you add in blood sugar, and it's even a bigger spiral. And I think that if there was just more, if I would have known this when I was there, I would have loved to, make this an area of focus.
Well, that's the thing. I see parents coming through our program. I see people like Bex, adults with it as well. And this is made to educate a parent or someone themselves to be able to turn this. I mean, Bex is saying within the first week, her brain fog of years or decades was gone. I'm going to ask you, Jody, imagine, and Bex too, imagine if you were given just even the blood sugar mastery section of our program, right? If you had learned that 5, 10, 20 years ago, and looking at the schools, what if this was available to parents for them to have gone through, and the educators and the kitchen at the school? What do you think the impact would have been, Jody?
It would have been just huge. I mean, it sounds something like so basic. It just would have, been huge, because then, when you have when it fluctuates, and then you have gastrointestinal issues because of the food intolerances and stuff, you have higher chances of behavioral issues.
Yes.
So I think that it would just been so much more eye-opening and made more sense had I known this back then, and that we could have shared this with the families.
Yeah. And Bex, what about for you? I mean, you lived most of your life with no diagnosis, I believe. And it wasn't until your children were diagnosed that then you kind of were diagnosed yourself. Had you known this information and been able to intervene in your children's lives, and then thinking back even to your own life growing up, what would that have looked like for you?
Oh, wow. Just even the blood sugar, for my own personal experience, I used to get incredibly anxious. If I had taken a snack, there would have been no need for any anxiety medications because I was hungry. I wasn't anxious. I was hungry. And to go back to my kids, how many times when they would have a meltdown due to, a sensory issue or something, they were just hungry.
Mm-hmm.
And because I think that the low blood sugar, what you're talking about, the cycling of it, you're incredibly vulnerable in those spaces to things. So anything that's going to come and hit you that is a sensory issue, if you weren't hungry, might not even have been a problem.
Well, I mean, think about this. In these special ed classrooms, a lot of times you have kids who can sometimes have violent outbursts. Mm-hmm. Now, think about just the emotion of irritability. The number one symptom of hypoglycemia, low blood sugar, is irritability.
Yeah.
Right? I mean, period. Boom.
I speak from experience as well, Bex, when you were mentioning that anxiety. My mom and I both, we have problems with blood sugar. And if we get a very low blood sugar drop, like let's say you wake up middle of the night or you wake up in the morning and your blood sugar has plummeted, it will actually trigger a panic attack in us, And so that's how I know that this is all connected to this, because it's happened to me, and you will have a legitimate panic attack, and it's all because of blood sugar. And as soon as I can stabilize that blood sugar, the panic goes away. So it's very real, and it's very scary, and nobody, you feel like you're dying when you have a panic attack, and it all goes back to blood sugar in that case.
Well, and Jody actually brought up a really good point. So I want everybody take notes right now. Okay. I'm going to say something none of your conventional docs have ever said. Kids and adults with these diagnoses and symptoms have tons of food allergies. Mm-hmm. And that's the thing. They already have a sensory processing. A lot of us have sensory processing. Texture is already a big deal. So you're already almost destined to be like, simple, refined carbohydrate. But then you put on top of it, how many people think they're eating healthy and they're not aware that their level of food allergens that their body's reacting to is really high. So The fact is that even if you quote unquote feed your child or yourself healthy, how many times is it one or two of those healthy items that are actually triggering an allergic reaction? So that's the other thing is not only are we dealing with blood sugar, food allergies absolutely matter in this population, because if you think about it, every time this kid eats something that gives them a tummy ache, every time an adult does this, eats something like this, and they have to go diarrhea, food trauma is really real for this population.
Right. And you can have anaphylactic allergies, or you can have sensitivities that are these low and slow ones that you can't quite put your finger on, but they're causing some big issues behind the scenes.
Bex, you had something to say about food mapping, the process we're doing.
Well, and what I was really going to go into is one of the key things of the program is no gluten. One of the biggest things for my children is when my children are not on gluten, they are different kids, myself too. And it's not, it's not a food intolerance for us. It's nothing other, we don't have celiac, but I noticed the difference in myself and my children when we eat gluten. I've been gluten-free for 15 years.
What do you notice, Bex, is different when you're eating gluten and when you're not?
Brain fog. Lots of brain fog when I eat gluten. My ability to think is very much, and then you also have physical discomforts. Your stomach doesn't feel good, and because your stomach doesn't feel good, you have pain. And when anything is in the background, just irritating you like that, of course, your sensory issues are worse. Your inability to be socially appropriate is worse because you have something that's at the point of your existence affecting you adversely. So if you can take away those adverse effects, if you can make sure you have a snack, if you make sure that you're not eating things that harm you, that those foods are easily available to you, like at school, I think it would be huge for kids.
Well, but here's the thing, guys, is that here's the thing, ladies, is that the answer that we hear out there. So conventional medicine doc said food doesn't matter. Feed what you can feed them that they'll eat, right? If you talk to a naturopath or a functional doctor, a lot of times it's elimination diet. Let's put these kids on an elimination diet or adults on an elimination diet. These kids are already really limited because of their sensory issues, their food reactions. And then you're going to eliminate like 60% of their food in their diet. Like that's really going to work. I want to know how many people out there did an elimination diet on their child with these symptoms and it worked. And then the other thing is that I really think it's important, and I'm a crusader for this. Absolutely, the only reason that you should be really eliminating a bunch of food is based on absolutely accurate data, and that's why I think for me, food mapping was really crucial. And Jody, I don't know what was your experience with food mapping?
It was eye-opening. So I was all red, like extreme in the dairy area. I have eaten dairy. I loved cheese. Who knew? I can't have the protein, I can't have sheep's milk, goat milk, yak, you name it. I can't. And who knew, but it makes a big difference. And going back to what Beck said about the gluten and, now I'm dairy free by default, but the gluten made a huge difference as well. And I think if that food mapping could be somehow part of the
everybody
diagnosis or part of the evaluation procedures in schools, I think it would just be so eye-opening, and it's just more data.
I agree with you, but the problem is food sensitivity testing truly sucks out there. You talk about elimination diet sucking, food sensitivity testing, and the people that are doing it and administering it truly is very inaccurate. And that's why for me, it took me 16 years to really come up with our food mapping process so that it's data driven and accurate, right? But the thing is this is and you guys, you trained with me for weeks and weeks around how to understand food mapping accurately, because the truth of the matter is when people have a lot of food allergies and they're in a very highly reactive population, there can be a lot of what we call false positive, false negative. There's also tests that are really bad and there are tests that are good, but that's a minority. So I think you guys underwent a whole educational process to understand false positives, false negatives, what to pull, what to reintroduce. I mean, this was a big deal. And that's why for me, I am an advocate. You got to have data, but you better damn sure make sure you have accurate data and a process that educates you guys on how to actually accurately administer these results.
It's so true, because when we talk about food mapping, this is something that Dr. Maggie has specifically created. Food mapping is not something that you can go to another doctor and say, hey, I'd like to go through food mapping, because I think a lot of us, and let us know in the comments if you speak from experience with this as well, who has had food allergy and food sensitivity testing done before? I know I have, and I know it was very expensive. Bex, you had it too?
Yeah, I did.
Right. And it was totally different from the process of food mapping that I went through in the program.
Yeah.
And what I learned through Dr. Maggie and that process really was able to truly eliminate those sensitivities now, to where my body's less reactive. It's not in a war zone with itself while I'm eating things that it doesn't like.
I think allergen management in kids and adults with these symptoms is critical. I really do. And it can be the difference between, and people, and we've seen it. Somebody was just eggs, but by eliminating eggs in 2 weeks, your kid don't have 50% or 80% of symptoms. Is that important critical data? Right. So that to me is real. To me, that's important. But I'm going to segue. I want to actually drop some more truth bombs here, because when you're talking about food allergies, a lot of people also assume that that's the only reaction that they are dealing when they're dealing with food. I'm going to tell you guys something, another holy grail point. One of the holy grail reasons why anybody has these symptoms is because your digestion sucks. Their digestive process sucks. I'm going to tell you that there's so many steps in digestion that I teach you guys on. And there's so many places where genetically it can go wrong that people don't realize that even one of these steps being broken can actually trigger a whole downstream effect of disease, actually. So even in one study, for example, like just the first step, and I say this a lot, is one of the first steps is stomach acid. Acid is needed to be antibacterial, to also break down meat and proteins. And it's one of the biggest symptoms of not being able to have enough stomach acid is bloating. How many of your kids are bloating after food? And then you assume, oh, it's going to be an allergy to the food. And then you're like, but it's random. No matter what I eat this week, last week, it happens. Well, if you have the data for food mapping and you get educated on digestion, we're able to tease apart, that's actually a digestive problem. This kid needs more stomach acid, need digestive support, and not just, oh, let's go on another elimination diet, or necessarily spend all this money finding 10 doctors to do this test or that test or that test. Digestion really matters.
Oh, yeah.
So, Dr. Maggie, I have a question for you then, because I know that digestion can turn around very quickly once you're taking proper digestive enzymes like Digest It and focusing on some of these other techniques that you teach about in the program.
Yep.
It can turn around quickly. How long then can it take, if that's turning around so fast, for some of these symptoms to also turn around?
Okay, I can tell you right now. I mean, Jody, you guys saw it in the program. How many people said, oh, we just had Olivia. Jody, you saw Olivia. I mean, it was Emma, actually. Emma said she's had 3 years of IBS. She's a young lady in college, and she said within the first week of taking Digested, and now it's 3 weeks now, her IBS symptoms are 100% gone. And she's had IBS for 3 years. That's debilitating, almost, interrupting her college. Right. So within the first week, she noticed this, but that's just the first literally tip of the iceberg. Think about this for 1 second. I'm going to be dropping another truth bomb. Okay. So you guys know this. If we're still staying on low stomach acid, then you can't absorb vitamin B12. Okay. Vitamin B12, specifically methylated vitamin B12, is critical for brain and nerve development, maintenance, and repair, function and repair. So if you have poor digestion, which we know for a fact, huge percentage, if not 100% of us with these symptoms have low stomach acid, then by definition, downstream, 100% of us is really deficient in methylated vitamins like B12, methylated folate, which then causes what? All these symptoms of the brain fog, the inability to focus, the sensory processing. A lot of these symptoms are made worse by a deficiency in these critical B vitamins.
It's all tying together.
Right? So, right? So, Jody?
Yeah, it's amazing. And I who knew I had low stomach acid? Again, without the data, you don't know. And think about what we do in school every day, all day, specifically, really a deep dive in the autism program. We collect data all day. We do discrete trials through the ABA programs, and that's all they do to see if the children are meeting their goals and where it needs to be adjusted and what they've mastered. So why not apply that to yourself?
Well, and that's why I think to me data is really important. I look at in our program, for example, just looking at digestive, right? So a lot of these digestion problems are actually very difficult to diagnose. Diagnostic testing is really far behind it. But yet, if you are trained on understanding what each step is and what the symptoms associated with, that's definitely one set of data point, right? But there's a second set of data point I'm always talking about. So for example, adults take digested and kids will take the digested chewable, right? Your response to a multiphasic digestive enzyme like this is another set of data. So give you an example, like if you knew you were negative on all these food testings, it was 100% negative, yet you take digested and suddenly your IBS of 3 years is gone. What does that tell you? What does that data tell you conclusively? It's your digestion.
Digestion issue.
Yeah. Absolutely. And this is exactly what happened this week. We have people coming up. So there's like, to me, these pieces of data that we gather are critical, as well as your education, because then you can use process of elimination. You can take data from your actual symptoms, and then your data from actually when I do an intervention, what's my response to that? Boom, you pinpoint exactly why you have this problem.
It's fascinating. I just want to highlight this comment because this is really what I wanted to get to the heart of, is that when you make these changes, you can see an improvement in these symptoms. I saw a significant reduction, this person says, in my sensory and focus issues when I made the food changes and increased the timing of when I eat. The improvement happened within a couple weeks. So you can make an impact by implementing these things that you're talking about.
And this is somebody currently, I can't tell the name, but it's probably someone who's currently in our program or has been in the program. So thank you for that feedback. And for me, it's really important for people. I want you guys to look at this live that we're doing as a community forum, a town hall where people can contribute and actually tell you, don't just take it from me. Don't take it from, Jody or Bex. This is like cause and effect, data driven, with real people with real outcomes that are happening all the freaking time. So it goes in the annuals of, I really only want to recommend things that work, because we've hit against too many walls as parents and as people with those symptoms ourselves.
Yeah.
Hormones.
Cha-ching.
That was Kara Price, by the way. She's saying it was Kara Price that made that comment.
Kara, and Karen just recently graduated from our program, right? So thank you, Kara.
Hormones are a big part of this also.
So everybody take some notes right now. I'm going to give you the next lesson, the next holy grail, which is hormones is freaking matter so much for our kids and for each of you, especially when you think about the timing of when these symptoms really started to get worse. Think about it. Look at your own timeline. Think about your own kid's timeline. I always talk about this hormonal timeline that we all have, and that's giving you clues. It's giving you a lot of clues. So what we find is that, for example, young teenage or right around puberty, their symptoms can sometimes get a lot worse. So you adding new symptoms or new diagnoses. And then you're finding adult population that are being diagnosed will be, let's say, women. Postpartum will be a time. Will also perimenopausal, between the age of anywhere 34 to 54, right around those 2 decades. It's women are getting diagnosed with that all the time. And men, what you will find is, yes, there's that teenage period of time, early teenage year, right around puberty, when there's a hormonal surge that can cause that to happen. But some men experience a rapid decline in their hormones somewhere around their mid-30s and also to their mid-50s. So you'll see men with a new diagnosis or worsening symptoms around that time. But yet the training that we give conventional doctors and even naturopaths and functional medicines around these hormone patterns and hormone shifts is very little. And I would love to ask both of you guys, what did you guys learn about your hormones that you felt was critical, and what were the changes that you noticed? Jody, go for it.
Well, newsflash. I have hormones of an 85-year-old woman. Who knew?
That's not normal. You're not
53.
oh, it's normal. Not normal.
Totally not normal again, but I didn't know this. And so that in itself was eye-opening. I was like, my God, I'm 53, not 85. What the heck?
Yeah.
So, so it's so like I'm at a loss for words as far as how this is all intertwined and connected, and it just all makes sense. And so knowing that now I have to, do some things, add some supplements in to figure it. Now I have breast cancer. So, so there's certain things I can and can't do with that. But so it's a work in progress. But again, data, actual factual data.
Mm-hmm. And think about that. The reason behind breast cancer too is that it's for many people, it's a hormonally related cancer. So these hormone imbalances is not only feeding these symptoms, but they're also feeding cancer that are hormonally sensitive. That's another reason to be, dealing with hormones. And looking at my own history, here you go, everybody. I wasn't diagnosed with ADD until I was 38. Never been diagnosed with ADD before. But at 38, I was diagnosed with ADD. And that was the time when I had the hormones of an 85-year-old. And when they told me I had early menopause, 36 to 38, that whole period of time. And the interesting thing is, by me actually learning how to understand how to test my hormones, how to understand the patterns that we have, and also its link with some of these symptoms, I was able to, quote unquote, it was like it's a miracle. Maggie came out of menopause, which I did at the age of, I think about 39. I came out of menopause, regular periods again. And my ADD symptoms, I mean, I took medication for another 2 years because I thought I was supposed to, right? And honestly, I thought that was only a solution. But my ADD symptoms were almost within probably 6 months of my periods coming back, completely gone. Completely gone. Wow. So, how many people are having these diagnoses or worsening of it because of a hormonal imbalance that their doctors know nothing about? Remember, I'm just going to list some hormone patterns here. I'm just going to do it. Okay, everybody pay attention. Write down some notes right now. I'm going to be another truth bomb. Okay. When you have patterns related to estrogen dominance, PCOS, low everything, when you have these hormone patterns, the symptoms you're looking right under the screen with ADD, ADHD, autism spectrum, sensory processing disorder goes freaking berserk. And yet, none of the doctors that you've ever spoken to or worked with knows what the hell I just said.
They don't. They really don't. And I can speak from experience because I was trying for years to get help with my hormones, and I never could. No one ever could crack the case until I joined the Transform program, truly. And it was like, I cried to finally understand what was going on with my hormones my entire life. And things dramatically turned around almost immediately implementing your suggestions. And on that note as well, for adults who are dealing with hormonal imbalances and issues, it absolutely, I can tell certain times of my cycle that I have focus problems, that I have brain fog issues, and it happens like clockwork.
Nailed it. Yes, right there. And that's the level of awareness we need to have for ourselves. You shared this on your vlog when you went through the program, but what happened with your periods?
Regular for the first time in my life.
Within the first month of being in the program.
Yes. And it's been regular every month since I've been graduated from the program. So that is something that I could not achieve. I couldn't achieve. And I tried. I felt like I tried it all, I researched it all, talked to every doctor I could find. And it wasn't until I finally found Dr. Maggie. And that was the whole reason that I sought you out, was it all fell into place. And I had been told by other doctors that I did not have PCOS because I didn't fit this profile or that profile, when yet I had so many of the symptoms, and you were able to read between the lines. And, this isn't all about hormones, but to break down my hormone panel and tell me it was clear as day, PCOS.
Well, I think what it is because I think from my own experience with having my hormones completely gone when I was, 36, early menopause, diagnosed by laboratory testing and symptoms. And then the turnaround and all my education around this over the last, 27 years in practice, the last 16 years was about learning about this. I feel actually really blessed that I'm able to take all that knowledge, experience, personal experience and training and put it into teaching you guys how to do that, because there's nobody, I feel like the level of training that doctors have gotten, none around this, even functional and naturopaths, that doesn't mean they're an expert on hormone balancing. I feel like it's critical to teach you guys how to do that. Right. And so, yeah, Jody, go for it.
And so I just want to add to that. So being an educator myself, that was one of the first things that came across to me was how you teach us. And it's done, many times when someone is as knowledgeable as you are, many times the delivery is so far over people's heads.
Yeah.
And I can say as an educator, the way in which you teach your program and to teach the general population of people that they're all walks of life from all over the world, is just, it's in such a way, it's so impactful, but yet it's in a way in which the average person can understand it and is not afraid to find out the results and is not afraid to take the leap of faith to say, okay, she's teaching me, this is her area of expertise, but she's teaching me in such a way that I'm able to comprehend it. And if you have questions or concerns, you are very approachable, and you'll help us get through it. And you always said mindset is huge in all of this.
Well, this is why I call what we do healing-centric education, because it really is an educational model for empowerment by teaching you how to do that. And in fact, since you're an educator, you might already know this, but do you know that we've been actually module by module, video by video, and workbook by workbook, worksheet by worksheet, making our entire program UDL compliant. And we've hired a team that is working with Harvard and has worked with Harvard to actually make sure that we can teach to everybody.
Mm-hmm.
We can teach to everybody. So that to me, it's like, this is about the healing-centric education. And I freaking love that term.
Mm-hmm.
And some people worry, some people think, oh, I have a learning disability, or I have trouble, I have brain fog. What was your process in learning this?
Excellent. I just have to say I was worried. I came into this program going, is this really going to work for me? I'm brain fog. I felt that was just, it defined me. And I was like, I don't know if I can do this. But, I took the leap of faith. And everything is very clear. And this is before Dr. Maggie's gone through and corrected everything. And I have gone back to some of the modules. And I didn't think you could make them better, but you did. And it's been very, very healing for me to have something that I could understand, that was laid out in a way that I could understand it. And that if I did have a problem, that I knew that I could come to the meetings and talk. And I got to hear other people also learning the same things. This is a program in which you are empowered. You don't feel, for the first time in your life, first time in my life, when I went to a doctor and I felt heard and I felt seen and I felt that finally my own health was in my own hands. And that nowadays I know that the program's always there to support me if I have questions, but so many times I can just go into the materials, I can go into the website and I can look up blood sugar, I can look up hormones, I can look up PCOS, and I'm going to have so many videos, hours and hours of videos that I can just deep dive into. And I have my pod. Ann and I and our other pod mates have gone, in our pod meetings, which we still continue, to discuss these things. You have so much access to learning and to support. And it is truly a life changer. I didn't talk very much about my hormones, but my goodness, I had a hysterectomy at 32 and had one ovary. And my doctor was like, well, what do you expect? You don't have to worry about your periods. Why are you complaining about anything? And up until I got here and I found out that, I had hidden PCOS and all these other things. My goodness, I am not angry all the time. I'm not easily irritable. I mean, my relationship is fantastic. I don't think I had any problems in my relationship with my husband, but my God, we are just, it is so many things get affected by this program. It is truly life-changing on so many levels. You'll come in for one thing. Like I came in for, my histamine problems with my MCAS and mast cell activation syndrome. And but everything's changed. My depression's gone. My anxiety is gone. My therapist is like, I don't know what you're doing, but keep doing it. My psychiatrist has taken me off all my psych meds. And this isn't just a couple months period, by doing the things and learning and, and it is something that requires you. This is not a quick fix, but it is easy if you do what you're told and you really dive in and you work on your blood sugar and you work on the mindset. It's going to do it for you when you do the work.
Before we go jump into final thoughts around mindset, I just wanted to ask the audience, if you have any questions, can you guys put it into the comment section right now? What I'm going to do is any question that you guys put in over the next 4 to 5 hours today, I will personally take a look at those and I will answer it in chat as well. And I can tell you already right now is if you put a question in there, we have hundreds of alumni that are watching right now that could already answer it. But I can tell you that if there's anything that they haven't answered or haven't helped with, I will personally answer those questions. So if you can put that in chat, that'd be really awesome. That'd be super helpful. Now, you both mentioned mindset. Mm-hmm. I have a huge problem with the fact that we actually don't teach people with these symptoms how to think differently. Like they already, to me, there's already a difference in how they think and process, right? But yet we don't work to actually change how they think or give them additional skills on how to think about things. What is it like tools to actually be able to shift your focus or hyper focus? Like what are some tools that can actually really help people do that? And for me, we don't do any, we call it mindset work here, but we don't actually do any mindset work for this population at all. I'd love for you guys to speak to effect is you guys have been through lesson after lesson and had done all the work on mindset. What's one mindset lesson that you did in the program that when you think about it, what if that was taught in schools to your children or to the kids that would totally have impacted how they think and their and results?
Bex, I have to call you out on this one because in our pod, she really had an I'll never forget this long as I live, an extremely powerful epiphany doing some of the mindset work as it related to the emotional home.
The emotional home, I have to say, is definitively the big one for me. I was living in an emotional home that, I'll just go in really quickly. It was a battlefield. Yeah. And I felt that I was standing in the middle of a battlefield with two armies on either sides, consistently shooting at me all day long. And I had no way to defend myself. And that was where I lived every day. Yeah. And with the emotional home, I was able to imagine myself getting on a bus and driving away from there. And I learned that I could find my happy memories and I could visit them and I could make a new emotional home that was all to myself. And anytime I felt like I was going to go back to that war zone, I got on that bus and I got out of there. And it has changed my life. Such a tiny thing. And this is just a very little portion of this immense program that made such a huge difference to me. And I was super, super glad to be able to share it with my pod mates.
It was very special, Bex.
Thank you.
Jody, do you have anything to add to that?
Yeah, I do. So the ants, the automatic negative thoughts, that was huge for me. And, it takes work, but it's definitely a work in progress, but that's huge. And then you just piece it all together and, you do the gratitude journal and, things of that and not get 10 steps ahead of yourself with the worry,
That was the big one for me too, Jody. So I understand exactly what you're saying and you apply these things. And for those of you who are new to this, you don't know what ANTS is, automatic negative thoughts, like she mentioned, instead of having these automatic negative thoughts, maybe you could change that thought pattern. Instead of going negative immediately, maybe think, okay, let's go to a neutral thought. Let's go to an alternative thought. And maybe then the outcome won't be negative like the initial thought was. And that has changed my life as well. And these are techniques that we've learned through you, Dr. Maggie. And I know you had to put your own work in to go through your own mindset work to heal yourself. And it has been so beneficial, I know for you, but for so many of us as well. And one can only imagine how beneficial it would be for somebody who is dealing with these issues that we're talking about today, autism, sensory processing issues, and ADD.
I think there's nothing like someone having had gone through it myself. I consider it a blessing, believe it or not, until I got to the point where I could get grateful for it happening to me. Um, I don't, I don't think I could teach it. I mean, I don't think I could have healed myself or teach it, right? And I look at my experience with ADD, ADHD. I look at my experience raising a child with an autism spectrum that, you know, until I did, and I had to go through it, and I'm very solutions oriented no matter what. And I love the fact that I'm blessed that I had the medical doctor. I'm not all, look, guys, I'm not against conventional medicine. I am so grateful I had that training. But then until I started to experience it myself with that experience, and then I added all the training that has to do with like root cause medicine, functional and naturopathic medicine, and added it together, and then saw real benefits and results in my child, in myself, and in everybody else. I realize like there isn't a place like this that exists. Like there isn't a program like this that exists. This is why we brought this up, because I had alumni after alumni saying like, why don't you make it super clear that this program is tailored specifically to be able to address this, whether it's your child or you. And we have parents going through this. We have children going through this. We have teenager and young adults going through this. And so I really feel like this is the whole kit and caboodle that's needed to actually address a problem as complex as this.
Yeah. The holistic approach. I mean, you talk about the 5 pillars, and it really does take all 5 of the pillars and mindset to address any kind of chronic health issue. But specifically, as we're talking about today, it can be so beneficial for these issues that a lot of them come back to what we talked about at the beginning: focus, the inability to focus. Mm-hmm. What other symptoms, Dr. Maggie?
Difficulty making connections sometimes, hyper focusing, feeling frustrated, disconnected, also feeling like irritable all the time and not knowing why, and just having things bother you or occupy your attention, having tics, having twitches. I mean, these are all parts of this. And yet they're so common, and yet people feel so alone, and there aren't big solutions for this. And yet it impacts almost all of us in one way or another.
Imagine for a moment if you could make that go away for yourself. Imagine for a moment if you could make that go away for your child. What would that mean to you?
And I would love to and I think the quality of your life is determined by the quality of the questions that you ask. So what's the question that you can ask about this that would be impactful? Like, is there another way out of this? What is the underlying root cause? What is my blind spot? What is my doctor's blind spot? What are they missing? So think about some of the questions that you need to ask. And I mean, honestly, in the comment section, feel free to put like, what's a question you really need to ask yourself and of your family, so you can actually really go into some deeper thought and processing about this, because I think we need to challenge what has been traditionally been told to you is there's not that much that can be done about it. You are alone, and there's nothing that much that can be done. I think it's BS. I really do. And I hope we're able to shed light on that. I'd love some parting thoughts from our guests. So we'll start with Jody, and then we'll go to Bex. What's one parting thought you have for anybody that's watching?
Don't second guess the decision to join this. Without a doubt, it is beyond. There's nothing like it out there, and it's root cause, it's data driven, and you have to do the work, and you'll see those results.
Yeah, I would just say that don't second guess it. I'm seconding Jody in that. Just do it. Dr. Maggie even has a price breakdown on the costs of being ill, and the costs, and my costs were beyond price. I mean, I had 0 life. I was not okay. I was just waking up every day because I didn't want to disappoint my family, but my quality of life was zilch, nothing. And now I can't even see that woman in me anymore. I am positive and happy and dreaming and healthy. I mean, I still have a few symptoms, but I have I believe that I will overcome them, and that I will become healthy and what I want to see in my life, because I'm following this program, because I'm doing the 5 pillars.
what you put together, Dr. Maggie. It's helped a lot of people, 2 people, right? 3 people right in front of you, 4 people if you include yourself.
Thank you.
And the impact, can't be underestimated.
For any of you guys out there that are watching this, if you know somebody, please help me raise awareness. I'd love for this video to reach 10,000 people. Okay. If you can tag somebody that you know in the comment section, that'd be really great. And then if you have any questions, I'm going to say, if you're on Facebook at all, and you've made a comment, check your message request section. We probably have reached out to you to share some resources with you. Every single thing we talked about, every single Holy Grail, every single truth bomb I dropped, we have additional trainings and resources that we're happy to share with you. But we can't share it with you. We don't know that that's what you need. So if you comment in the comment section, that'd be super helpful. We're also going to drop a link with which you can chat our team. So our team will drop a link right now in chat, and also on top in the copy of this video, there's a link to chat our team if you want more information to learn more.
Jody, thank you so much for joining us. Bex, thank you so much for joining us. This was an enlightening conversation, and you both added so much insight to it. So we really appreciate your time.
Thank you.
Thank you.
Thanks, everybody.